Sulphur Springs, we're right in the middle between Dallas and Tyler. You know, it's really hard to get specialists to come out in rural Texas to provide 24/7 coverage for those type of services, to be there in person.
We had our primary care physicians who were performing both the outpatient and inpatient care. And really where they found where they needed help was in the ICU for the intensive care unit. That's complex management where they needed care and availability at a moment's notice.
And this was at a point where the family practice physicians in our community were covering the hospital. So they would have their clinic duties, and then they would also take turns on a rotational basis where they were responsible for coming over here to the hospital, rounding on patients, staffing the ICU, and being responsible for all of that care in addition to their clinic duties, which is kind of a big ask.
And that's where telemedicine really picked up for us, for the ability to provide that intensive care, to have our intensivists here 24/7, but not have to physically be here.
There was just some conversations at that time between a couple of the physicians at Access TeleCare and our hospitals about a unique way of looking at how to bring specialty out to rural health care. This offered a unique way of being able to bring in an intensivist, even though they couldn't be here in person, but they could still be right at the bedside, you know, using this unique technology to be able to take care of those critically care patients.
So that was our first service line here in Sulphur Springs. And then from that, we launched teleneurology and an acute stroke program where we're able to keep and see patients from that initial event that they present to the ER with all the way to discharge, which is kind of our goal.
Were it not for our ability to use telemedicine, we would not be able to take care of near the number of patients here, and that would greatly increase the number of patients that we would have to transfer out. People that needed critical care, people that needed pulmonology, people that needed infectious disease.
This way, we're able to take care of those patients here, having that 24/7 presence by the physicians being there in the room.